What is HMO, Health Maintenance Organization? An HMO is a managed care health insurance plan that provides comprehensive coverage at the lowest cost, requiring members to select a primary care physician, PCP, who coordinates all care and provides referrals to specialists within the network. What is an HMO? A health maintenance organization, HMO, is a type of managed care plan that provides health insurance coverage through a network of doctors, hospitals, and at the end of the day, it can be a basic health insurance coverage with a network and other healthcare providers. HMOs focus on preventive care and cost containment by requiring members to use in-network providers and obtain referrals for specialist care. Hashtag key features of HMO plans. Feature description. Primary care physician. Must select a PCP who manages all care. Referrals required. Need PCP referral to see specialists. Network restrictions. Must use in-network providers, except emergencies. Lower premiums. Generally the lowest cost managed care option. Preventive focus. Emphasizes wellness and prevention. How HMO plans work. Step description. 1. Member selects a primary care physician, PCP. 2. PCP serves as gatekeeper for all medical services. 3. PCP provides referral for specialist visits. 4. Member must use network providers. 5. Out-of-network care not covered except emergencies. Hashtag HMO versus PPO versus EPO comparison. Feature HMO, PPO, EPO. PCP required, yes, no, no. Referrals needed, yes, no, no. Out-of-network coverage, emergency only, yes, higher cost. Emergency only. Network required, yes, no, but cheaper in network, yes. Premiums, lowest, highest, median. Out-of-pocket costs, lowest. Exam tip. HMO equals lowest cost, requires PCP, requires referrals, in-network only. PPO, highest cost, most flexibility. EPO equals hybrid, network only like HMO, no referrals like PPO.